Texas children are wired. Their teeth, that is. The Lone Star State spent $184 million last year on free braces for kids covered by Medicaid. That's more than the rest of the country combined. A News 8 investigation discovered the huge outlay, and now the state is taking action to correct the problem. Here's Byron Harris with the latest.
Texas Senator Jay Nelson put 2 riders into the state Health and Human Services budget as a result of our reports. That's the good news. But it gets worse before it gets better. News 8 investigates. This is not a water park. It's the swimming pool at the $2.2 million mansion of a Texas dentist in Frisco. The estate belongs to the owner of Smiley Dental, a multi-million-dollar chain of clinics specializing in Medicaid orthodontics. Its owner was not alone among big-buck Texas Medicaid dentists. Last year, 34 Texas dentists collected more than $1 million each for Medicaid orthodontics. Orthodontic services are limited to the treatment of children who are 12 years of age and older, according to the Texas Medicaid Provider Manual.
How old are you?
9.
News 8 has learned nearly a quarter of all the braces paid for under Medicaid last year in Texas may have been installed by waiving state regulations.
The rules are clear. The rules are clearly stated that children under 12 do not get full orthodontic treatment.
And yet, 24% of the braces put on kids in Texas last year were on children under 12.
How old are you, he said? 10?
There are special cases where kids under 12 can get orthodontic treatment under Medicaid.
The state dental director from Texas Medicaid Health Partnership has to personally approve that case.
Numbers obtained by News 8 show that nearly 19,000 children got that special approval from the state last year.
But clearly, I mean, these are thousands and thousands of children who are getting braces, not because of a health-related reason.
State Senator Jay Nelson put 2 riders on the budget of the Department of Health and Human Services. One would change the way Medicaid dental care is managed, altering the way dentists are reimbursed.
Clearly, we need to see if there are certain companies or individuals that are not being totally honest about what they're doing.
Another rider directs the Inspector General to detect, investigate, and prosecute abuse by dentists and orthodontists who participate in the Texas Medicaid program.
And if we're allowing that to take place, then it's shame on us. We need to bring in more inspectors and make sure that it's not going on.
Smiley Dental has not returned News 8 phone calls, so we did not get to ask them about Smiley's practices in treating under 12 patients. Senator Nelson says at some point the entire law needs to be revamped, but there was not time to do that after our reports and the end of the legislature. The riders were part of the finance bill the governor signed into law on Friday. Byron Harris, Channel 8 News.